Good evening, everyone. Thank you for joining us tonight. I'm very happy to welcome back Dr. Syed Mursalin. We have known each other for quite some time already. He has been participating in the AIN events in the earlier years of the network, and we're happy to reconnect Dr. Mursalin, and maybe later on we can discuss some potential collaborations and projects together. He is now the CEO of PAC1 Health Alliance, and he'll tell us more about their organization. And joining him is Professor Dr. Sana Iftikhar, Assistant Professor at the Allama Iqbal Medical University in Lahore, who is advising also the PAC1 Health Alliance. We're very eager to learn more about this organization, Dr. Mursalin, Dr. Iftikhar, because we'd like to know how we can synergize the activities of the network and Pakistan. So I give the floor to you, Professor Syed.
Thank you very much, Tia and Alvin. I think we are also very much pleased to see you again after many years. And it was a wonderful time that we had, and we have been in the when the EHAN was evolving, and as you know, the E-Health Association of Pakistan was there, and I was part and parcel of EHAN and EHAB Association Pakistan, and we were collaborating in that context. And also, I was the national coordinator for health information systems with the Ministry of Health, and we had a wonderful, you see, some of the sessions we had with them very much impressive, but unfortunately, we could not keep contacts. But now, you see, the reconnection is a player for us also, you see. And now I am wearing a different hat. I am taking care of PAC1 Health Alliance, which is an organization working for the prevention and control of infectious diseases. So I would be discussing, as Alvin said, introducing my organization, the partnerships that we have, the projects that we have been doing, and the projects in the pipeline, the challenges, issues, and opportunities. Because once you are like an independent organization, there are certain strengths, weaknesses, opportunity, threats that you are all the time have to face. You see, compared to once you are in the government positions, you see. So talking about One Health, you may be all knowing that One Health it recognizes the health of human, domestic, wild animals, plants, and environment are closely linked and you know that. This is very common, and this is very popular notion nowadays. And One Health approach mobilizes multiple sectors. I think it's easy to say to mobilize multiple sector disciplines and communities, but not that easy to put this in practice, because you see in most of the countries, you see the departments, the ministries, or the sectors are working in silos, you see, and it's very difficult to make them speak to each other. They are so committed and busy in their own environment that it becomes very difficult. So PAC1 is the alliance that we founded in 2014, and is a professional group like organization. Our organization has public health physicians, veterinary experts, entomology, agriculture. So we have linked with many professionals, and we have they are part of our executive body, executive board, and the technical working groups, and they are I mean they are like our advisors, working with us on various forums. This is all those diseases which spread through multiple interfaces, like the animal to human, vector to human, water to human, food. So those all diseases are a part of our focus, you see. And we have a formal partnership with a government, and I think this is very critical, that you need partners here. You see, it's not, you cannot do the things in isolation. You have to partner with the government, you have to partner with the common, you see, organizations, national, international. We have a secretariat, advisory body, you see, and we have coordination with multiple organizations. The interest area is certainly we want to promote this concept of One Health promotion. We are very much interested to work on emerging and neglected tropical diseases, risk communication, biosafety, biosecurity. So all these areas, as you can see, are those which need collaboration with multiple sectors, you see, and these are our areas of interest and work. So we did a recent study, and Dr. Sana would be giving you some flavor of this. And AMR, we did also we were part of the regional study on that. So how we do it, we do organize, like probably this is similar to what you are doing. Advocacy seminars on One Health, community-based organizations for One Health, research studies, field surveys, capacity building. But our focus is for the moment is our own country, Pakistan. But certainly we have good connections with the regional organizations, linkages with the national, international, and certainly we are very much keen and interested in promoting the accelerated use of information technology for health, for One Health surveillance and dashboards. We have a good expert directory, and we are, you see, very much curious and to organize policy dialogues, promotional seminars on One Health issues, on multiple issues on One Health importance, like on rabies, like on CCHF, like on those kind of. So partnership in implementing partners, we have two types of partners. One type of partner is those which are all the time collaboratory, very closely working with us. Ministry of Health, for example, at Punjab, the PSPU, University of Health Sciences, National Agriculture Research Center, but there are still collaborating partners. The implementing partners and part and parcel of our strategy, but the collaborating partners are, you see, at our disposal, and they are cooperating, and we have like a memorandum of understanding with these organizations. This is our journey, started in 2014 and this 2022. In between, we have been organizing number of activities, like on vector-borne disease, we had 2 years project. We did we developed national level health situation analysis reports. We did a very exhaustive exercise on AMR mapping and gap analysis and recommendations with the other partners of the SAARC countries. Mapping of, because when the COVID-19 pandemic started, we did 2 nationwide studies, one on the COVID-19 readiness exercise, resilience exercise, and one on the governance structure of for pandemics in Pakistan. And currently we are pursuing a project what we call is the One Health event-based surveillance project, and Dr. Sana, my colleague, would be dilating on that. So we have kept ourselves busy, and we have been doing some useful assignments and work, which has been appreciated by our partners. This is the number of reports, study, publications, One Health mapping exercise, One Health surveillance system, One Health training program. We developed 2 training programs. We organized training workshops for the policy level and planners and policy level people. Consultative and seminar workshops. We have training of trainer workshops on One Health promotion and event-based surveillance. We developed that training program, event-based surveillance, and applied it in the country. And so the major project accomplished. At this stage, we are doing One Health EBS project. We are working with AMPNet, which is an organization in the Middle East, on the development of regional One Health curricula. As Dr. Sana was explaining, that we did an exercise on readiness, COVID-19 readiness. So there was some recommendation, and we are now working with the government to translate this recommendation action planning AMR surveillance exercise, regional governance mapping exercise. We did a country hospital sector profile. In the environment sector, we did a high risk assessment of persistent organic pollutants. Vector-borne disease project. We developed a mobile application for integrated vector-borne disease, which has now been adapted by the provincial government. We organized biorisk safety and management trainings, and we did a Leishmania gap analysis exercise with the support of Courts and Bill Gates organization. So this is our Leishmania study, some glimpse from that. You see, we did it with CISET. CISET is an organization for Eastern Europe on disease surveillance, and CORDS is a connecting regional organization. That was a collaborative effort, and similar studies were done in similar studies. Similar templates were used in Albania, Jordan, and Pakistan, which are high in cutaneous leishmania problem. And this is a One Health issue. This is a neglected issue. So the main objectives of this exercise was to advocate the cause of neglected diseases, look at the burden determinants of this disease, and gap analysis for the control, the management issues or the systems that we have in the country. We identified there were like some of the districts which are very high in leishmania in the country. And the areas that we looked in the study was the program management, the case detection abilities or competencies, disease surveillance competencies, control of reservoir hosts, integrated vector-borne disease, epidemic preparedness, and the level of operational and strategic level, operational research. So these were the main strategic areas. Those were focused to look at the management of this. So these are the districts which were found very high in Leishmania, and these are, and some of the main of the district belong to the Sindh province in Pakistan. So this study, this exercise was very widely accepted, circulated. We also presented in the core group meetings, and it was, you see, very well presented in some of the publications like CDC, Lancet, and you see some other important journals. So the main recommendations that we got were need to have long-term policy, advocacy vision. We need to address the shortage of drugs, and we need to enhance the community level awareness of that. So this is some you see the snaps from the workshop that we had in Albania, because the three countries which did this study, they got together and we presented our findings and recommendations. And this is a glimpse from our national level group that we helped us in organizing this study, the technical working group. And then about virus management, we did a capacity building. Firstly, we developed a curricula on that, and we made an assessment of some of the leading hospitals in Lahore about the current status of virus management in their hospitals on a standardized tool. And then the capacity building workshops were organized. Regarding the vector-borne disease project that we had, 2 years project, 2016-18, we were focusing on in pilot districts for improving disease detection and reporting of vector-borne diseases, looking and then you see focusing on enhancing the epidemiological capacities in priority districts and promoting awareness and reduction of for population at risk. So again, for VBD, vector-borne diseases, a number of core areas were focused and looked at in the pilot, some of the pilot districts that looked at organizational status, capacities, situation of vector-borne disease, the burden of disease, level of interdepartmental partnership, situation of collaboration. Because again, vector-borne disease is a One Health subject and is very common. The dengue, malaria, very common in our country, maybe also in so many other countries. And so as part of this Park One Health BBD project, this BBD project was supported by Skoll Global Threat Fund, you see, and it was 2 years project. And we are part of this, we developed some studies. We also developed, we did a mapping exercise. We also developed a mobile application on vector-borne disease, you see, situation analysis. So we have been partnering with the South Asian One Health Disease Surveillance Network, and part and parcel, though this network was not very active as we expected, but we have been meeting at least once in a year or something like that. And this is an informal, you see, arrangement. And we, as part of this, we have been meeting for the One Health promotional activities. And we have been also working on antimicrobial resistance mapping exercise. So this is the scope to strengthen regional capacities, but there are certainly the political barriers to work smoothly in this region. Cross-border disease surveillance issues, organizing trainings on one of the emerging infectious diseases, developing a reliable effective disease surveillance program, sharing of experiences, best practice, experts, resources. I think this is very important because we have sometimes similar situations, conditions in our countries, and sharing of experience to deal with a particular subject becomes very critical. So One Health major issue of our organization, there are several One Health issues, but the main areas of One Health, as you know, is the zoonotic diseases, AMR, vector-borne diseases, environmental contamination, food safety. These are the 5, the most important. I think there are many, but these are the 5 most important. But luckily, we have been doing bit by bit. We cannot claim that we had very aggressive nation because of Pakistan, 220 million population, big country. So, but we have been setting some trends and examples, doing some exercises on some specific One Health areas. The One Health study, the AMR study that we did, that was a collaborative, as I said, South Asia conference. And there were organizations like Park One Health Alliance, Eastern Mediterranean, or you see, Infinite, South Asian one. So they have been working in different countries, Pakistan, Afghanistan, Bhutan, on standardized templates. And then at the end of the day, we developed a regional map. We completed a regional mapping of gap analysis, One Health AMR, surveillance specially. What is how is the AMR surveillance being done? Mapping and gap analysis needs and current practices. And the main objective was to develop common protocols for AMR data collection, analysis, interpretation using One Health approach. And piloting. So the 2 parts of the exercise were completed, but unfortunately, we did develop the common protocols, but the piloting was missed out because of the lack of support. Probably we will be still searching so that this part could be accomplished. So for Pakistan specific, a number of strengths for AMR surveillance, there are strengths. There are committees, strategic plan is there, action plan there, core group on AMR is there. There is some allocation budgeted. Sentinel sites have developed AMR, but you see there are good institutional arrangements. But unfortunately, there's strategic plans, action plans. They have become like an academic exercise. That is there, but if you come to the implementation, there are serious, you see, gaps. There is issues with the central coordination for AMR partners, AMR, National AMR Surveillance System, not multi-sectoral, One Health surveillance system, because you know the antibiotics are being used by multiple sectors, you see, agriculture, veterinary sciences, livestock department, health, public health, animal health, environment, food, so many things. So there is no common, what you call One Health AMR surveillance system. Data sharing is a big issue. AMR awareness among health and animal professionals is lagging. And weak implementing One Health approach. That's a frequent self-prescription in health. There is a trend of self-prescription, insufficient funding. So there are issues and problems. So for One Health service. So the main issues certainly, and we are focusing on that we have been working on One Health surveillance system, the capturing of real-time data. We do have link with certain data systems in the country, but they don't, it's not One Health surveillance system. We have developed a One Health dashboard, and Dr. Sana would be dilating on that. Evidence-based decision making, and certainly we want to make a big contribution towards operational. There are concepts, but we want that the One Health should be operationalized, and we want to link and have good partnerships with other organizations like EHAN, CORDS, IDRC, and others who are already working in similar areas, One Health Commission, you see, and we are always eager to have connections with them. So thank you very much. This is all, and thanks a lot for giving us an opportunity to introduce Park One Health in its work in the country.
Thank you, Dr. Mursalin, for such an elaborate and interesting presentation. And thank you, AHN platform. I definitely share my sincere gratitude for providing me this opportunity to present, and I hope I would be able to serve the purpose. My today's presentation is on, as Dr. Mursalin has mentioned a lot, about the ongoing projects from the platform of POHA, Park One Health Alliance. I will be detailing on one of a very important and ongoing project, that is One Health event-based surveillance project. As Dr. Mursalin just mentioned, and as I hope most of the participants must be aware regarding the importance of One Health, and One Health is not the new thing, we all know it. Since the beginning, since the ages, this world, this planet Earth is being shared by all the species together, by humans, animals, environment, all the species, and we all are very much well versed that if we want to maintain the equilibrium, if we want to maintain the harmony, health of every species is as important as the health of other species. This is the same concept, just it has a new professional imperative. So it's just a way of thinking that recognizes that the health of people, animals, and environment are inextricably interconnected. And we are all, and I think post this pandemic, COVID-19 pandemic, there should be no confusion in any part of the world or in any mind that if one species wants to enjoy the health, wants to enjoy the life, all other species should be a part of that. And it has been observed why does One Health concept has gained so much importance recently, as we have just mentioned, that this is not a new concept. Then why is it so much important now? Because the previous 2 decades, we have observed a number of epidemics and outbreaks. And it is quite interesting to note that among all these epidemics, more than 70% were emerging from the animals, from zoonosis, from the diseases which emerge from the animal population, the same case as in the case of COVID-19 even. So now the human population, as we know that the human beings, the crown of the creations, we put the most of the stress, the most of the attention towards the health and well-being of the humans. But now this is very much well known that if we want the well-being of the humans, the animal population, as well as the environmental well-being should be very much there. Keeping with this background, POHA collaborated with international partners such as Ending Pandemics and national partners and constituted a 30-month project from 2021 till 23 that is still ongoing, but soon going to finish in March 23 May. This is titled as Deploying One Health EBS, which means Event-Based Surveillance in Pakistan. I would be elaborating briefly because the main forte of my today's presentation is to make you people aware of this ongoing project. So first of all, what was the vision and goal of this project? The main vision was to create an integrated One Health platform that allows early identification of disease outbreaks with facilitation for joint response. As you might be knowing that in Pakistan and in other similar developing world, very less collaboration and in real-time coordination exists at the first point. Secondly, IT, the involvement of information technology is two very initial steps. In most of the countries like ours, we don't have one common dashboard where the data from all the sectors is accumulating, and from there that data can be analyzed and that can give us some view and some links about what is going to happen in the future. We all, I think more or less, we are all are on the same page. So this first primary objective of this project was deriving appropriate solutions from information communication technology background that will enable smart collaborations across multiple One Health sectors. This was the primary objective. And to reach that objective, few other ones, to form rules and norms for integration of new components into existing systems, as when we were going towards the collaboration among different sectors, therefore the rules and norms had to be settled down. Another objective was to train key stakeholders in One Health and event-based management procedures. Because let me tell you, the situation in Pakistan regarding One Health at that time was quite an interesting, that it was whole a novel concept for most of the people working in the field. Even they were not aware that why this concept is here and what would be the benefits. So it took us quite a long time in sensitizing all the important stakeholders and bringing them together. So it was quite sort of a teaching at the initial stages. To create timeliness measures for project progress tracking and to demonstrate the created tools, manuals, which we developed over the time and share the experience with other provinces and with the other member nations and on a wider perspective with the CORDS, connecting organizations for regional disease surveillance. As a part of this broader study, another side-by-side parallel study was regarding mapping and gap analysis, which of course, which was very important to do as we wanted to know what are the ground realities, that what level of coordination exists at the time between all the One Health sectors. So in accordance with that, the first step was to have the mapping of One Health departments, organizations, and to know about their scope, strengths, and gaps. The next thing, a very important thing, was to have a snapshot of the existing information systems of these One Health sectors. One thing, like to know about what are the current One Health departments are doing and how they are retrieving their information, how they are how they are accumulating it, and then how they are analyzing. So in first part, we tried to do a detailed mapping of all the One Health institutions, as well as to have focus group discussions with their management and leadership and to understand their governance and their structure. And as far as their information systems was concerned, we did a detailed study of their whole planning regarding data collection and their in-place surveillance systems, and what they are actually doing currently. Then the system, how they are managing that data, is there some feedback mechanism or their response mechanisms, then the quality assurance for that data, we did this. And these were the major findings of this study. That overall 51 key sites of One Health sectors were interviewed. And among these, 20 were from the public health, which I say like from the human health sector, 20 were from the animal health sectors, 6 from the environment department, and 5 from the food and agriculture department, as it is visible on the graph below as well. Then this study was conducted at the federal level as well as in one of the biggest province of Pakistan, that is the Punjab province. Azad Jammu and Kashmir, which is the government independent state, and that was also probed. And 8% of the data of the interviews were from AJ&K, 57% from Punjab, and 35% were from the federal level. DHIS, which stands for District Health Information System. This information system is primarily for public health, meaning by human health. And then we have the ADRS, Animal Disease Reporting System, and that primarily covers the animal sector in Pakistan, in Punjab and federal department. So we identify that these two systems are the current major sources of data, which are retrieving the data from their respective sectors. However, the process of national level collation or collaboration of these data was severely hampered. And it was found that this lack of collaboration and coordination to some extent can be attributed to devolution, which happened in 2011. In 2011, in Pakistan, what happened? Let me share a few things. That health was one of those sectors which was devolved to the provincial level, meaning by all the provinces of Pakistan, they are quite autonomous, they are independent in managing their health department. So if there were some benefits of this devolution, but the biggest loss was, I think, that the collaboration and coordination, it suffered a lot, intersectoral as well as intrasectoral, and among provinces, coordination was just to a very minimal point. So these were the major findings, that no regulatory frameworks and One Health functioning units were lacking. Then the public health, which I am telling you again, that human health sector, it had relatively better established information systems as well as the practical systems. They have independent diagnostic laboratories. However, there was still lack of coordination, intra and both intersector. And what about the other systems like animal, environment, food? Their information collection systems were quite hampered. And then there was very limited authority to the system managers for data sharing and dissemination. Various indicator-based surveillance systems were found in each sector, but no, practically speaking, evidence-based surveillance was not in practice. So we concluded at the end that currently no robust One Health event-based surveillance system exists. Here I would like just to throw a little bit light on the indicator-based surveillance and event-based surveillance. I think most of you would be knowing that in Pakistan particularly, our ongoing information system relies on indicator-based surveillance. Indicator-based surveillance, which is facility-based, which relies primarily on the data which is routinely collected through the official surveillance systems. And the biggest issue with this indicator, otherwise it's quite reliable, it's quite authentic, and we have quite extensive system of this indicator-based surveillance. And let me share this, that Dr. Mursalin was a very key person in developing all of the health management information system in Pakistan. It's quite good system, but the only issue with this IBS-based information system is that as the data is going to be collected over a period of time, let's say 1 week, 2 weeks, mostly it's the monthly report that is generated. So if any unusual event is happening, it will be detected after a gap or lapse of 1 month, because after a 1 month time period, that data will be analyzed. Whereas in opposite to this IBS, if we have some space for event-based surveillance relies on a number of information sources, and if some unusual happening reports, it can be immediately reported to the higher authorities. Event-based surveillance relies on both kind of information sources, formal as well as informal. Formal would be the same, like the healthcare workers, field epidemiologists, our people who are working in the field. If they see some unusual case, unusual happening, they can report to the higher authorities. That stays for the formal sources. But we have a large chunk of informal sources for information as well, like from the emails, from social media, public web reporting. And then we have the e-print medias, web reporting, these kind of the things. So event-based surveillance, if we go for the IT sector, in many parts of the world, particularly the Western part of the world, They have such kind of softwares which automatically retrieves health-related news from all these mediums, informal sources of news. And then that kind of sources, if once they are verified, they are reported to the higher health authorities. This is just the idea of event-based surveillance, and we wanted to have this kind of surveillance system in our dashboard, which we were working for. Why was it? What was the rationale? That, as we all know, that in the current age of epidemics and outbreaks, every country is supposed to prove themselves as epidemically intelligent. And if a country claims that they are epidemic intelligent country, they should have at least these 4 prerequisites. They should have the ability for detection of potential public health events. They should have the ability for the verification of these events, risk assessment of public health events, and the very important one, this risk should be communicated to the concerned authorities. So with this background, POHA uptook this project, which was a very pertinent project, very important one, and a new one for in context of Pakistan as well. This project had its kick orientation meeting in April 2021, as this is the flow chart just in front of you all. Then there were a number of meetings which were planned, a number of training of trainer workshops were held. Before these workshops, we developed the curricula, we developed the manuals for the training of the trainers, because our objective was to do the capacity building of the trainers so that they can go to their respective departments and disseminate this One Health word. And then all the departments should be sensitized, they should be ready for the data sharing, and the next step would be to train them for the event-based surveillance. So after developing these study manuals and all these strategies, we held a number of training of trainer workshops. And the good thing was that these workshops were attended by majority of the One Health departments, like human health, animal health representatives. Then we had the people from the environment department, we had a representation from the food department, from the people working at the points of entry. So we had quite a galaxy of the people who were working in a number of One Health sectors, and they all participated enthusiastically. Then, as you see, there are a number of the meetings which were going on. This is just a glimpse of the manuals and the study reports which we prepared as a part of this ongoing project. So once we were done with disseminating the One Health message, and there was this stage that most of the people in different One Health sectors were quite sensitized about this message and about the importance of the event-based surveillance. So next very important step was the development of the dashboard. And what we had in our mind, definitely we developed this dashboard with the help of IT professionals. And what were the sources? But we were very much keen. One thing was to take all the sectors on board and to develop memorandum with them, to have this sort of confidence with them for sharing of the data. They all agreed. No doubt that was much difficult task. Dr. Mursalin handled it really very well to take on board all the important stakeholders from all the sectors like human health, animal, environment. They all agreed to share their data. The next very important step, we wanted for our dashboard to have special portal for event-based surveillance. And we want that portal to include all such, like to retrieve data from the SMS, mobile apps, WhatsApp, public online reporting system, things like that. This was the conceptual framework which we wanted our dashboard to have. What was this framework? That, as we can see, I think you would be able to see this cursor. We have public health sector, human health sector. In Pakistan, we have this animal health sector separate, and then we have the vector-borne diseases department. And in addition, let me tell you that the environment department and the food department, although they are working quite good in their own domains, but the system of their information gathering and collection and analysis is quite in its initial stages. So initially, we were not very much hopeful that we would be able to gather that data as well. But what we wanted, that from all these sectors independently, information should be coming to this dashboard where it should be accumulated, and it should be analyzed in the form of bar diagrams, pie charts, and then geographical maps as well. And from these summaries then can be shared with the higher authorities for the response people. what were the current indicator-based information system which were going on? These were like DSS, DHIS, DHIS2, which is the recent version of that. These are all for the human health sector. Then we have animal disease reporting system for Punjab, which is for particularly for the animal health related. Then during the time of the COVID-19 pandemic, Pakistan government developed a dashboard. On that dashboard was exclusively for COVID-19, but the data from all the sectors, from all the provinces was being gathered at this data. So this set sort of a help for us. We had an idea that this is quite possible. If we want to accumulate the data from multiple sources, it can happen. Similarly is the case with the dengue dashboard and then a few other ones. These were the systems which were proposed, which we wanted to retrieve data from all these sources and put it into the one dashboard which we were developing. And then with the help of the IT support, this dashboard was developed. This is the login phase of the dashboard. Here it has the username and the password. As you can all see, only the specific personnel, they can have entry because it is concerned with the data entry and then the analysis. This is the home page of our dashboard, One Health Surveillance Dashboard Punjab. Initially, as we all know that there are a number of diseases which come under One Health domain, One Health umbrella, and initially it was not possible to cater to all the diseases. So we just focused on One Health priority diseases. As we all know that this One Health disease prioritization is a process and most of the countries have gone through that process. Pakistan has also listed down its priority One Health diseases. So we just focused on that initially, like COVID-19, dengue, rabies, anthrax, CCHF, salmonella. These were the diseases for which data was collected, not collected, but accumulated, because data for these diseases was already being collected by the human health sector, by the animal health sector. We developed the confidence with them, we assured them, we took them on board, and they started providing us the data, and it was accumulated on this dashboard and then analyzed in this way, in the similar way as it is visible on the screens. And this is the geographical presentation. We also did this effort with the IT team, that where there was accumulation of a particular disease, it was depicted on the maps. Then our dashboard also has the provision to provide the summary of disease-wise as well. For example, the dog bite cases, because dog bite is again a very important, rabies, we all know that it is a very important One Health issue. Data for this case is being gathered by the human sector as well as the animal health sector. So it is, and if we want to know the detailed breakdown of these cases, we can have in this way, that who were the person, gender, age, place where it happened, a detailed breakdown. And then the same information is also analyzed in the form of different graphs and tables, just to make it more palatable and more descriptive. Then again, the geographical representation is here, and it helps us a lot in just having an idea that how this disease burden is located. So this was this sharing. What are the things that, excuse me, the only issue current is that we want this information to be shared on our dashboard in real time. We want that immediately, as soon as the case is reported at the Ministry of Human Health or the animal, it should be depicted on this dashboard, and soon it will happen as well. Secondly, we have a specialized portal for EBS. A bell icon is displayed over there. And currently, we only have the manual entry from the news, from the informal sources of information. But soon the population will also be taken on board, and the field workers will be allowed to chip in and do the entry for the events happening in the field. What were the challenges and opportunities? During all this process of One Health sensitization as well as development of the dashboard, we came to know that currently there was no culture of information sharing. All were working in silos, and they were very comfortable in their independent silos, and they never wanted to share. Strongly devolved administrative system. Then the surveillance, then we found great disparity among the information system of different departments. Like the Human Health Department had quite fairly developed surveillance systems, but the information system for animal health sector was quite compromised, but extremely weak information systems were there for environment and food sectors. So when we are going towards the dashboard type of thing, What we wanted that every system should have at least a certain level of information systems, because only then it can be collaborated and analyzed together. There were no SOPs for intersectoral coordination, which required urgent action. But amongst all these challenges, what was the opportunity? What was the ray of hope? And ray of hope was that during COVID-19, we saw extreme level of inter and intra-departmental collaboration, and that was not only in one province, that was cross-provincial level. All the data was being accumulated from the laboratory section, from the animal health section, from the human health section, from the diagnostic feature point of view. Like you just name it, and every department was on board and they were sharing the data. So this raised the hope that if we can do this for one particular disease and for during a war-like situation, why can't we do it during the peacetime? And why can't we do it for rest of the diseases? So that was quite an opportunity. And we felt that as this project was quite in time of the COVID-19 pandemic, so people were quite sensitized. I think I'm running short of time, so I would be just touching that what we did during POHA has also involved, was the main key stakeholder for conducting the readiness and resilience exercise in terms of COVID-19. And that was done by Sandia Labs and Ending Pandemics. This was named as a During Action Review and Tabletop Exercise. It was a very novel kind of thing from November 2020 to January 2021. Why novel? Because major part of, if not major, then quite a large chunk of the epidemic had been passed on, but the country was still going through it, and it was predicted through projecting models that a lot more has to come as well. So that this exercise was done at that time. It had both retrospective versions as well as the prospective versions. How it was conducted, that there was certain teams were formed, such as epidemiologist team, laboratorian team, animal health, emergency responder, communicator, team of point of entry. Certain teams were formed. Every team had a team leader, and they were provided with some questionnaires, scenario-based questionnaires. And they were asked that if this happens, how would you respond? What would be your line of action? How will you coordinate? And then participant-led analytical discussions followed on. And this all culminated in a very progressive report. Report was formalized, and this not only helped us in identifying what we have done, but also it acted as a lesson that how we can improve our ongoing fight against COVID-19. That was just the overview of our DART exercise, but I would like to end my presentation on this very, I would say, an emotional quote, which I heard during one of these conferences of One Health. I think it was shared by the EP personnel, that in a world where no creatures are truly isolated and diseases spread as fast as jets can fly, we are all canaries, and the entire planet is our coal mine. Any species can be a sentinel of danger. Let me explain that during coal mines, canaries are taken, small birds. When the oxygen level drops down, these canaries died. So they act as a sort of sensors. But on this planet Earth, we don't have these kind of sensors. Who are the sensors? We, the human beings, the animals. So when an issue arises, fatalities occur, only then we get to know that, oh, there is just this problem is occurring. So we need to be on our toes. Any species can be a sentinel of danger. But what is the option? There should be the widest array of healthcare professionals, which should be on board, collaborating and coordinating. Thank you very much.
Thank you, Professor Dr. Sana. Very interesting presentations, Dr. Mursalin and Professor Sana. We actually reached the top of the hour, but I wanted to just ask you, there are people asking if the slides are shareable. So we'll work on how we will distribute it. I think the purpose of this meeting is to get to know POHA formally now through the webinar, so that it can get to know all the other organizations in the call. So please share your email address or contact information in the chat box so that they know how to reach you. I just have one question, and then maybe if there's another question in the chat box, we can also read that out. But how are you now organizing all of this between the two of you, with Dr. Mursalin, Professor Sana? How are you now reaching out to the subnational levels. This is also a challenge for all of us, in the call that are looking at the national problems, but there are subnational problems and also regional problems. So what's your secret, or what is your secret sauce, so to speak, on how you are able to reach out to the subnational level?
Yeah.
Dr. Mursalin.
Yeah, thank you very much for this important question. I think at this stage, we are working at the federal and one of the provinces called Punjab. Dr. Sana is also based in Punjab. So we are working there, and we are, for the moment, you see, for any project to start and any activity to scale, it's important, the sensitization component is very important to start with, to convince people, you see, how to get. So we are mostly working at the strategic level at this stage. And we are not into the operational levels. And the good news is that we have developed a technical working group, which is comprising of multiple types of academia, government department, One Health related, because usually the mainly One Health relating departments are public health, animal health, food department, and environment. There could be others also. You see, wherever the intersectoral coordination is desired, that's One Health. See, but at the stage we are mostly working with a livestock department and at the strategy level. And we have been organizing our meetings through that technical working group. And government is all the time supporting us. You see, the Ministry of Health, you see, is with us, and the provincial departments and other types. We have regular MOUs with them, and that's how it works. But it's not a big organization, I said. It is something to start with, and we are making noise on this particular subject. Thank you.
Yeah, exactly. I would also like to add on that the very first step in this context was to have the confidence building measures with all the important stakeholders. And as I just mentioned, that health is the provincial chapter now. So before starting off with these kind of projects, the first step was always to take on board all the important stakeholders. And that was, though it was a difficult task, but Dr. Mursalin did it very well, as you know very well that he's a well-connected person. So fortunately, every time when we started for a new project, we had good participation from all the departments and from different levels as well. Thank you.
Thank you, Professor Sana. To me, what I learned today is that POHA is a formidable organization. It's a very strong organization. And I think you've committed to supporting the government. And I think that's what we encourage all our members to do, to be able to complement government with the work that they're doing. The work of digital health is so big. There's no one organization that can do it. Government alone cannot do it. But government together with civil society like POHA, I think has a stronger chance at really creating a responsive digital health system because they're working together. And with that, I'd like to thank Dr. Mursalin and Professor Sana. I hope that we can have another session later on and deep dive. We'll get questions from the audience, from the members, and then we'll configure another webinar soon. Thank you very much, everyone, and good night. Good night. Thank you. Thank you. Dr. Mursalin, let's continue our discussion on the partnership offline. Thank you. Good night, everyone.
Thank you very much, everyone.
Thank you, Paula. Thank you.
Thank you, Anna.